How to use a stethoscope. A stethoscope is a medical instrument used to hear sounds made by the heart, lungs, and intestines. Using a stethoscope to hear sounds is called auscultation. Medical professionals are trained to use stethoscopes, but you can learn how to use one too. Keep reading to learn how to use a stethoscope. Method 1. Choosing and adjusting a stethoscope. Get a high-quality stethoscope. A high-quality stethoscope is important. The better the quality of your stethoscope, the easier it will be for you to listen to your patient's body. Single-tubed stethoscopes are better than double-tubed ones. The tubes in double-tubed stethoscopes can rub together. This noise can make it hard to hear heart sounds. Thick, short, and relatively stiff tubing is best, unless you plan to wear the stethoscope around your neck. In that case, a longer tube is best. Make sure that tubing is free of leaks by tapping on the diaphragm, the flat side of the chest piece. As you tap, use the earpieces to listen for sounds. If you don't hear anything, there may be a leak. Adjust your stethoscope's earpieces. It is important to make sure that the earpieces are facing forward and that they fit well. Otherwise, you might not be able to hear anything with your stethoscope. Make sure that the earpieces are facing forward. If you put them in backwards, you won't be able to hear anything. Make sure that the earpieces fit snugly and have a good seal to keep out ambient noise. If the earpieces don't fit well, most stethoscopes have removable earpieces. Visit a medical supply store to purchase different earpieces. With some stethoscopes, you can also tilt the earpieces forward stethoscopes to ensure a better fit. Check the earpiece tension on your stethoscope. In other words, make sure that the earpieces are close to your head but not too close. If your earpieces are too tight or too loose, readjust them. If the earpieces are too loose, you may not be able to hear anything. To tighten the tension, squeeze the headset near the earpieces. If the earpieces are too tight, they might hurt your ears and you might have a hard time using your stethoscope. To reduce the tension, pull the headset apart gently. Choose an appropriate chest piece for your stethoscope. There are many different types of chest pieces available for stethoscopes. Choose one that is appropriate for your needs. Chest pieces come in different sizes for adults and children. Method 2. Preparing to use a stethoscope. Select a quiet place to use your stethoscope. Use your stethoscope in a quiet place. Find a quiet area to ensure that the body sounds you want to hear will not be overpowered by background noises. Position your patient. To listen to the heart and abdomen, you will want to have your patient get into a supine position. To listen to the lungs, you will want your patient to sit up. In other words, ask your patient to lay down. Heart, lung, and bowel sounds may sound different depending on the patient's position, example, sitting, standing, lying on one side, etc. Decide whether to use the diaphragm or bell. The diaphragm, or flat side of the drum, is better for hearing medium or high-pitched sounds. The bell, or round side of the drum, is better for hearing low-pitched sounds. If you want a stethoscope with really high sound quality, you might want to consider an electronic stethoscope. An electronic stethoscope provides amplification so that it is easier to hear heart and lung sounds. Using an electronic stethoscope may make it easier to hear your patient's heart and lungs, but keep in mind that they are expensive. Have your patient put on a hospital gown or lift up clothing to expose skin. Use the stethoscope on bare skin to avoid picking up the sound of rustling fabric. If your patient is a man with chest hair, keep the stethoscope still to avoid any rustling sounds. To make your patient more comfortable, warm up the stethoscope by rubbing it on your sleeve, or consider buying a stethoscope warmer. Method 3. Listening to the heart. Hold the diaphragm over the patient's heart. Position the diaphragm on the left upper part of the chest where the 4th to 6th ribs meet, almost directly under the breast. Hold the stethoscope between your pointer and middle fingers and apply enough gentle pressure so that you don't hear your fingers rubbing together. Listen to the heart for a full minute. Ask the patient to relax and breathe normally. You should hear the normal sounds of the human heart, which sound like loop-dub. These sounds are also called systolic and diastolic. Systolic is the loop sound and diastolic is the dub sound. The loop, or systolic, sound happens when the mitral and tricuspid valves of the heart close. The dub, or diastolic, sound happens when the aortic and pulmonic valves close. Count the number of heartbeats you hear in a minute. The normal resting heart rate for adults and children over 10 years old is between 60 to 100 beats per minute. For well-trained athletes, the normal resting heart rate may only be between 40 to 60 beats per minute. There are several different ranges of resting heart rates to consider for patients under 10 years old. Those ranges include newborns up to 1 month old, 70 to 190 beats per minute. Infants 1 to 11 months old, 80 to 160 beats per minute. Children 1 to 2 years old, 80 to 130 beats per minute. Children 3 to 4 years old, 80 to 120 beats per minute. Children 5 to 6 years old, 75 to 115 beats per minute. Children 7 to 9 years old, 70 to 110 beats per minute. Listen for abnormal heart sounds. As you count the heartbeats, you should also listen for any abnormal sounds. Anything that does not sound like loop-dub may be considered abnormal. If you hear anything abnormal, your patient may need further evaluation by a doctor. If you hear a whooshing sound or a sound that is more like loop, whoosh, dub, your patient might have a heart murmur. A heart murmur is blood rushing quickly through the valves. Many people have what are called innocent heart murmurs. But some heart murmurs do point to issues with heart valves, so you should advise your patient to see a doctor if you detect a heart murmur. If you hear a third heart sound that is like a low-frequency vibration, your patient might have a ventricular defect. This third heart sound is referred to as S3 or a ventricular gallop. Advise the patient to see a doctor if you hear a third heart sound. Try listening to samples of normal and abnormal heart sounds to help you determine if what you are hearing is normal. Method 4. Listening to the lungs. Ask your patient to sit straight up and breathe normally. As you listen, you can ask the patient to take a deep breath if you cannot hear breath sounds or if they are too quiet to determine if there are any abnormalities. Use the diaphragm of your stethoscope to listen to your patient's lungs. Listen to the patient's lungs in the upper and lower lobes, and on the front and back of the patient. As you listen, place the stethoscope on the upper part of the chest, then the midclavicular line of the chest, and then the bottom part of the chest. Make sure to listen to the front and back of all of these regions. Make sure to compare both sides of your patient's lungs and note if anything is abnormal. By covering all of these positions, you will be able to listen to all of the lobes of your patient's lungs. Listen for normal breath sounds. Normal breath sounds are clear, like listening to someone blowing air into a cup. Listen to a sample of healthy lungs and then compare the sounds to what you hear in your patient's lungs. There are two types of normal breath sounds. Bronchial breath sounds are those heard within the tracheobronchial tree. Vesicular breath sounds are those heard over the lung tissue. Listen for abnormal breath sounds. Abnormal breath sounds include wheezing, stridor, rhonchi, and rales. If you do not hear any breath sounds, the patient may have air or fluid around the lungs, thickness around the chest wall, or airflow that is slowed down or overinflation to the lungs. There are 4 types of abnormal breath sounds. Wheezing sounds like a high-pitched sound when the person exhales, and sometimes when they inhale as well. Many patients who have asthma also have wheezes, and sometimes you can even hear the wheezing without a stethoscope. Stridor sounds like high-pitched musical breathing, similar to wheezing, heard most often when the patient inhales. Stridor is caused by a blockage in the back of the throat. This sound can also often be heard without a stethoscope. Rhonchi sounds like snoring. Rhonchi cannot be heard without a stethoscope and happens because the air is following a rough path through the lungs or because it is blocked. Rowls sounds like popping bubble wrap or rattling in the lungs. Rowls can be heard when a person inhales.